Good evening, friends. Welcome back to a brand new episode of BMC Global Live AL-HILAL Health World, Nothing But Lifestyle. I am Anupama Menon. Good health is not valued until sickness comes. In this talk show Health World, we have expert doctors from various fields providing valuable information on different medical topics to assist you all on your journey towards good health. Lower back pain is a very common ailment that a lot of people grapple with. As simple as it may sound, it negatively impacts the quality of life of an individual. All the day-to-day activities that we take for granted, like bending down, carrying your own child or lifting something heavy, or even indulging in any kind of sports activities, that becomes an issue when you suffer from lower back pain. But having said that, the good news is there are treatment options available, there is a cure for lower back pain, and of course it can be kept at bay. So I'm sure all of you would like to know more about lower back pain, and to discuss this in detail, today we have with us Dr. Badrinath Gumperla, specialist orthopedic surgeon from AL-HILAL Hospital, Hind. He has an experience of over 12 years in the field of orthopedics. So let's go over to him and find out more about lower back pain. Doctor, thank you for joining us on the show today.
Thank you.
And welcome.
Okay.
So as I mentioned earlier, lower back pain, this is something we keep hearing. A lot of people, all genders and of all age groups, they grapple with this problem. So if you could just tell us what are the causes, the underlying causes of lower back pain, and is it different for various age groups?
I introduce myself that I'm Dr. Badrinath, currently working in AL-HILAL Hospital, Hind branch. Today I would like to give a brief introduction about the causes of low back pain in various age groups. Okay, for our comfort and discussion, I will categorize lower back pain in different age groups: greater than 50, 20 to 50, and less than 20. So first of all, I'd like to say very important causes about lower back pain age greater than 50, because they are the most common subsets of the low back pain. So the first reason for the back pain for age greater than 50 will be around, we call it as spondylosis. Spondylosis or arthritis of the spine. When we call it as arthritis, naturally as the age progresses, our bones and joints get degenerated. So that will stand the first common cause for the low back pain for age greater than 50. Okay. And other issues like disc problems and diabetes and vitamin D deficiency, there are many other causes of low back pain age greater than 50. We are more concerned of still age groups greater than 80, where some serious things has to be evaluated while treating a case of low back pain. Patient comes all of a sudden with a severe low back pain, unable to stand or walk. So it will be one episode, first episode, or recurrent episodes for the past many times. So for those patients, I like to suggest a few X-rays and then get it treated. As the age progresses, the causes of low back pain will differ. Suppose if the patient is more than 80 years and they come with a severe low back pain, with a deformity, unable to stand or walk, then the treatment options and diagnosis will change. For extreme age groups greater than 80, we'll sometimes evaluate the causes of back pain like cancers. Sometimes we get metastasis into the spine. Sometimes there will be senile osteoporotic fractures. These are things have to be evaluated. Not only spondylitis, but as the age progresses, the bone will be extreme weak, so that they need not fall. Also, they just when they cough, when they sneeze, also sometimes the bone get fractured. So these are, according to age group, if we categorize. So after 50, first stands for the spondylosis. Second will be disc problem and lumbar canal stenosis, and muscle stretch, tendon injury. So whenever we try to lift any weight, suddenly these all things can cause back pain. And coming to age group between 20 and 50 years, there are many options like we call it as a disc prolapse for younger age groups. So usually while lifting heavy weight, when it is not accustomed work for them, so people usually get with severe low back pain and radiating pain, we call it as, because whenever there is a disc prolapse, the disc compresses the nerve in the spine. So the pain will be radiating from back to one leg or both the legs, sometimes totally unable to walk and stand sometimes. So So the presentation will be like that. Sometimes there will be normal muscle pull or tendon injury when all of a sudden the patient complains of pain without any injury, without any work and all. That comes to be like we can diagnose them as slight muscle injury or tendon injury like that in the spine. So for them treatment initially will be some medication, rest advised, and some lifestyle modifications, support, everything considered. So coming to age less than 20 years, there are many other serious problems also which we have to be evaluated for diagnosing low back pain in age 20 years.
But is it commonly seen below the age of 20
Yes,
years?
yes,
Because
yes.
when we
Even
talk about back pain, we mostly associate it with slightly older age group.
Yeah, because even 10 years boy also, 10 years girl also can get back pain. So other things like any spinal deformities like scoliosis, infantile scoliosis and juvenile scoliosis are the things are more concerned, because initially they will complain of pain. As the time progresses, the deformity and the structure of the spine will change. If we diagnose them early, it will be very easy for us. Other thing is for younger age groups, backpack. Nowadays,
The school bags are very heavy.
School bags are very heavy. It's more than around 10 kg. So that's one of the very common problem what I see in daily OPD, because their backpacks are too heavy. That causes their back pain usually. And some people, some younger age groups contain some deficiency also, vitamin D deficiency. One of the cause for indirectly relating with the quality of the bone, and it may cause some back pain.
And the kids also these days, their posture is always not right
Posture
while
is
watching
also
TV.
one of the important
seeing
factor in younger age groups. If without any injury, all of a sudden they get some back pain, it can be because of when they sit for a long time and watch TV or mobile, or when they study for a long time, they make it because of posture, some back pain. That will be very transient only, hardly they can get relieved in 5 days or 10 days max. Okay. And coming to other causes of pain in less than 10 age groups, we have like spinal deformities, congenital spine malformations. That's an entirely different topic. I mean, if we that can be entirely discussed in separate topic for less than 10 year age groups.
So what are the symptoms generally? How does it manifest? Is it just because you spoke about the pain radiating to the leg also? So are there any common symptoms that we should all look out for? Something which is, which we feel that could lead to a lower back pain issues.
See, I mean, the low back pain always the word itself, the sentence itself says there is pain.
Pain.
That's okay. So apart from low back pain, the presentations will be very different. Some people can complain only of dragging pain of the leg, or both the legs, or only one leg. They don't have any back pain at all.
Okay.
But the complaint can be, I mean, the origin of complaint can be from the spine itself. That is one mode of presentation. Second will be they have stiffness. When they can't bend, they won't have any pain. They complain of any stiffness of the spine. This is another mode of presentation. Sometimes they will be walking in a different way, like tilted spine like that. That is only also because of spine. They won't complain of any pain. They walk little bit tilted. When they come
tilted to one side.
Tilted to one side.
Okay.
So whenever there is nerve compression, the muscle go into spasm. So one side, if the muscle is going into spasm, automatically our spine balances it. So you will walk in a different style or different manner. The patient may not complain of more pain. So these are various presentations. Sometimes only you may having pain in the knee and radiating downwards. Okay. So these are very different presentations of compressed nerves in the spine.
So it varies from person to person.
Yeah, person to person.
But even if it's a leg pain or a slight change in the way you walk, these are symptoms that these are red flags that we should look out for.
We can't only think of leg pain.
On the
we can also examine the spine.
Spine as well.
Sometimes patient complain of hip pain. They won't have any back pain also. Hip pain radiating downwards. So there are many
underlying cause could be lower back.
Exactly, lower back.
So how do you diagnose it? What are the investigative methods used? We hear about MRI scans and all that, X-rays. But besides that, how do you come to the conclusion that this is a lower back pain issue?
Of all the tests and all, I prefer first clinical history is very much important in diagnosing back pain. My first preference is only history.
History.
So probably it may take some 10-15 minutes for the entire details to ask. when is the onset, type of pain, radiating, aggravating factors, relieving factors, everything. So first I diagnose most of the low back pain patients clinically first, and then I can confirm with an X-ray or MRI or something else, sometimes ultrasound. There are many things are there. So my first preference for diagnosing back pain will be history. Proper history taking is very much important. So then you can say, as you can take one
the nature of the injury you will be able to understand.
Suppose if at all any injury is there, then we can go for straight away X-ray like that. There are many investigations like range from bones can also sometimes, for old age groups, patient is having severe pain, stress fractures, etc. Many are there. There are only 100% there is no diagnostic procedure where we can 100% say that that cause of the back pain can be ruled out in one investigation. It cannot occur. Okay, there are many lot investigations. Sometimes we take ultrasound. Some non-orthopedic causes also can cause low back pain. Okay, like aortic aneurysm, any gynecological problems, any abdominal tumors. There are many are there.
So that's why it's very important to know the history of the patient.
Yes, history of the patient is very much important.
And then you will decide what are the means and tools to be employed to find out what is the cause.
Exactly.
Okay, and once it's been diagnosed as lower back pain, what are the treatment options available for patients? We hear about physiotherapy and exercise and medications also, I believe, are advised by doctors. Okay. So what are the various treatment options available for the problem?
There are many treatment options available. So it depends on the episode of pain, duration of pain. Suppose if the patient comes with a chronic back pain, not dealing with medication, recurrence of back pain, then it's better to evaluate with an X-ray, MRI sometimes. If it is single episode of back pain, if the patient wants immediate treatment, we can straight away go for medication and then wait for his relief, and then afterwards we can go for an investigation like that. Because all the patients may not be affordable to go for MRI and all. So what I prefer is if history is matching my diagnosis, then I straight away go for medications starting.
And see if it works or not.
Yeah, I will ask the patient to come after 5 days, 1 week. I will examine him once again. If the pain is not reduced, then I will go for X-ray like that. Okay. So I make it as a habit of treating them first and then diagnosing, because that's not an issue. If I feel there is an emergency of taking an X-ray right away, I will straight away advise for X-ray. Sometimes straight away we need MRI also. So it depends on patient to patient, and I prefer first diagnosing with the history first, and then you can see about it, ultrasound, some renal calculi also, they will get back pain. Sometimes both there is a problem in the spine as well as in stone.
Kidney stone, back pain is
both sometimes can occur together. So we'll be treating like only back pain, but problem will be something else. Okay. So if the pain doesn't come down, then again we need to check like that. Sometimes it's a hard net for every doctor to diagnose back pain properly.
So can this be prevented? I'm sure a lot of it is to do with our sedentary lifestyle also and our posture, because we keep hearing that if the posture is not right, it can lead to spondylosis. But are there any other measures that we can take to prevent this from happening?
Yes, prevention is always better than cure. So somehow many doubts, what to do, what not to do regarding back pain. First, I prefer for, suppose if a patient has severe back pain, my suggestion is best to go for rest. Rest is very important, and we prescribe some muscle relaxants, painkillers. Okay. Next, if the patient wants little bit immediate treatment, we can go for physiotherapy. There are many modalities of physiotherapy. So I prefer sometimes lumbar corset, brace and all. So it depends on the duration and recurrence of symptoms, everything like that.
So when is the right time to visit a doctor? Because a lot of times, we have lower back pain. We just pop in a tablet and within 1 or 2 days it goes, and we don't bother to actually get it investigated further. So what is a tipping point? When do you feel a patient should actually seek medical intervention?
See, one of the ways to prevent the recurrence of back pain is to maintain the posture. Suppose if patient is a driver, he needs daily driving. I suggest him a back support so that the spine will be straight and it won't cause much burden on the spine. That is first thing. Many of the software employees, they face, every week at least 4 to 5 patients I will get only for back pain, neck pain. Patients will be very young, will be around 25 years, 20 years, 20 to 30 only. So they'll be having recurrence of neck pain, back pain. They'll be because of, I think those things is absolutely related with the profession. Okay, they need some mild exercise. Spinal strengthening exercises are there. If you try to search and if you try to know about it, it will be better. That should not be done when you have more pain. Once the pain gets subsided, only then you have to start spinal strengthening exercises. Okay. At the same time, abdominal muscles also. When our muscles are taut, it will gradually decrease the load on the spine so that you don't feel much back pain frequently. Okay.
So all these should not be done, physical exercises should not be done when you are having an episode of lower back pain.
Yes.
So to prevent that, we can have some sort of exercise or take care of our posture and all that. And what about vitamin D? You know, this is something which is linked to your bone strength, I believe, and especially after the age of 50s, it's said that your calcium level goes down, and now we are not exposed much to sunlight, so vitamin D deficiency has also become very common. So how would you link this to lower back pain, and do you think it's important to take supplements after a certain age?
Yes,
vitamin
definitely.
D and calcium?
See, after age of 50 years, the daily calcium intake recommended is 1400 milligrams and vitamin D is 400 international units. Suppose, as we all know, sunlight gives vitamin D. Okay, there is some duration around 30 to 45 minutes which you need to expose to sun, first thing. And if you wear long sleeves and we are not getting exposed to sun, okay. And many people think that if at all any glass is there in between the sun and patient, there is some UVB spectrum in the sunlight, so which actually forms vitamin D. If there is a screen in beside, even though it's a transparent glass, it will be filtered. You can't get a proper vitamin D synthesis based on that sunlight. Okay. So actually studies say that afternoon sunlight will be better for around 10 to 15 minutes per day. That will be advantages for the maintenance. Suppose if the patient has deficiency, so he keeps on taking sunlight, diet supplements is not sufficient. I recommend initially of medicines for first 2 to 3 months for the deficiency to balance, and then we can
to maintain it,
yeah, to maintain it, yeah, you can do
getting other sunlight.
Yeah, exactly. Suppose one glass of milk gives around some 120 units of international units of vitamin D, for example. So we need to take 4 glasses of milk per day, which is, I think no one will
normally
take 4 glasses of milk.
Yes, it's not possible.
So in this instance, if you calculate the dose and other things, it's better to take medication initially for 2 to 3 months. Afterwards, many patients, what they do, they will take for 2 months and they will stop. So we are lacking in the maintenance. Maintenance is very much important. So greater than age 50 is always recommended to take vitamin D and calcium. At least need not be taken for years together. At least per year around 3 months I recommend to take calcium, vitamin D, some other vitamins also. Always be beneficial like that.
Okay. And what about disc prolapse?
Yes,
is it the same as lower back pain, or when it progresses, does it lead to a disc prolapse?
Yeah, this is a entirely different, very big topic of disc prolapse. I'll just in a brief introduction say a few lines about disc prolapse. See, we have vertebrae on the spinal column, vertebral column, in between which we have discs. Discs are just to compare with a, suppose for a normal person, who cannot understand, I can just compare with a shock absorbers for the car. Okay, so it's the same function which disc take for our body. It's a shock absorber exactly. Suppose when we try to jump, when we try to do any work, the shock of the mechanics of that body shock will be absorbed by the disc. Whenever the disc gets degenerated or weakened, or when you have more stress on the disc, it naturally tends to deviate from the normal position. Okay. So that we call it as disc prolapse. So whenever the disc gets prolapsed, we can't make it back. First thing, it will be going on increasing as you press, as you make burden more on the spine. First thing. So we should evaluate at what stage the disc has been prolapsed, mild, moderate, severe, very severe. At one stage it will start compressing the nerve. Then our symptoms start, like one leg paining, both legs paining, some different tingling, numbness, paresthesia. There are many different presentations. One of the emergency for disc prolapse is what called as cauda equina syndrome, which they have some paresthesia for both the legs and weakness, and we call it as some bladder and bowel disturbances. Whenever the disc totally comes out and compress the nerves, sometimes it will be regarded as an emergency. So if there are any symptoms like that, we need to go for an emergency surgery also for severe disc prolapse. So there are many types actually.
To be worried about.
Yes. Okay.
So why is it so important to evaluate and investigate a back pain? Because you mentioned earlier in our conversation that it could also be some other major underlying cause, like could be a cancerous growth or any other issues like that.
Yes,
so if you could just tell, for the benefit of the viewers, why it's so important to get your lower back pain evaluated properly by a doctor and not dismiss it lightly.
Yeah, definitely. See, the things of concern for lower back pain is not only pain, first thing. So some other problems, like suppose if there is a fracture of the spine, for example, it doesn't mean that it's only a fracture. It's because of weakened bone why we get fractured sometimes. So we'll evaluate the causes of weakening. If we search in this aspect, there will be some, we call it as secondaries. Suppose the cancer will be some other place, and sometimes it go and sits in the spine. So in that way we will get secondaries, and it will cause the lysis of the bone. On that we will get fracture. So commonest will be from for females, it will be like a carcinoma breast. It will be commonest, carcinoma lung, and for gents is carcinoma prostate, carcinoma lung.
So this can all manifest as lower back pain, as one of the symptoms?
Yeah, sometimes. Suppose if the patient already has a cancer and presents to me with severe back pain, unable to stand walk, then I should think of some metastasis also.
Okay, so that's a warning sign.
Yeah. We'll be evaluating, the back pain is not only just back pain, we need to see nerves surrounding it or causes of back pain as the age progresses. And there is entirely different entity, we call it as ankylosing spondylitis. I think many of us don't know. So that is entirely different thing. So our spine becomes entire stiff. Early morning if you tries to stand from the bed, it will be very, very painful. If you take one X-ray, it will be very normal only for some patients, for any early stage. We need some blood investigations for that. Okay. And the other thing is, some patients will get tuberculosis of the spine. These also, if we take proper history, we can have some suspicion of tuberculosis for the spine. Initially, X-ray looks normal. Patient will have only pain. Sometimes night pains. Patient will be unable to sleep. Patient will have daily fever. So, that's not like normal back pain what we think. Some things need to be evaluated thoroughly, what I feel. Okay. If the diagnosis is precise and exact, then treatment will be very easy. I think always prevention is better than cure for back pain.
Absolutely, yes.
So what I prefer is, if you have recurrent back pain, or if you want to thoroughly evaluate the cause of back pain, it's better to consult a doctor. And if you, it doesn't mean that you have to follow all the investigations, not that. Just you can take opinion. That's my humble request to all of you, everyone.
So thank you so much, Doctor, for taking the time out to be with us today and for providing valuable inputs about lower back pain problem. Thank you so much.
Okay.
So friends, I hope all of you found this episode very informative. If you suffer from lower back pain, please don't dismiss this as a minor problem. Please seek medical intervention. As Doctor rightly mentioned, prevention is always better than cure. And exercise well. Exercise is not a punishment that you're giving your body. It's actually a celebration of what your body can do. A healthy lifestyle, proper exercise will definitely keep lower back pain at bay. Wishing you all a very healthy and happy life ahead. This is Anupama signing off till we meet again next time. Good night and stay safe.